Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
We'll talk about some of those things as they come along. All right, if we go to slide number 2, when we're talking about orthopedic surgery coding, there are some suffixes that we need to identify that will help us choose the appropriate CPT code. And I've given you a list of 5 of these here. These are the most common ones that we use. The incision versus excision, which would be otomy versus ectomy. And lysis is a detachment or reduction. I also say sometimes that it's a stripping. Desis is fusion. And so if we're doing an arthrodesis, that's a fusion of a joint because arthro is joint. And then plasty is reconstruction, and it also can be plastic repair, but we don't necessarily need to have plastic to be able to report a plasty. So those are 5 of the common suffixes that will help you determine where you need to be within the CPT manual for coding. Another issue that we deal with in our coding for orthopedics is on slide number 3, and this is acute versus chronic. There are some CPT codes that are in their descriptions. They either include acute or chronic, but more importantly, we need to know acute or chronic for a lot of our diagnoses. Acute is normally an injury of some type or an accident, and there's a sudden onset and it's short term, where a chronic condition is a long duration, it's frequently recurrent, and the patient's normally had it for a while and really hasn't done anything to have this problem occur. Arthritis is a very good example. That's a degenerative thing that kind of starts small but then gets big. So that's going to be our acute versus chronic. And many of our diagnosis codes are determined by acute or chronic. The other thing we have is in our fractures, we have trauma or traumatic fractures versus non-traumatic fractures. Our traumatic fractures, again, are usually our accident or injury, where our non-traumatic fractures are pathological fractures. 2 kinds of pathological fractures are a compression fracture or a stress fracture, and these are normally caused or are caused by other comorbidities. For instance, patient may have bone metastasis or they have osteoporosis, and so their bones are either, their density or the condition of their bones is altered, and so they are likely to break just because of the weakness of the bones themselves. And so we do have coding related to both kinds of fractures, and ICD-10 does the same thing also. But the pathological fractures, as well as malunions and non-unions, totally explode in ICD-10. So that's important to know. On slide number 5, I've got listed some infections that occur in orthopedics after either traumatic injuries or problems with prosthesis or implants or grafts, and also post-operative wound infections. What I normally try to do with my presentations, if you haven't listened to me before, is I try to make them so that you can use the presentation when you're back at your desk trying to code as a guide to give you an idea where some of these codes are. And so this is basically what I've done with this one. Instead of, this is kind of a guide to say this is where these codes can be found. On slide number 6, I've listed the codes related to the integumentary system. And we do use these codes in orthopedics. Wound closures, there are 3 kinds of wound closures, simple, intermediate, or complex. And it is coded by the type of wound closure and then the size. And
Supercoder is the fastest growing online reference tool with more than 25,000 subscribers. call 866-228-9252 to get a free product demo, or sign up at supercoder.com for a 7-day free trial.